Hi, this is Dr. James with Disc Louisiana. Today we're going to be talking about surgical options for the treatment of arm pain or radiculopathy. Previously, Dr. Shamia in a discussion has talked about one surgical option, which is total disc replacement. This is usually reserved for people that have no arthritic component to their their spine pathology and have large disc herniations that are causing their arm pain. An alternative to total disc replacement with people that do have arthritis is a neck fusion, commonly called an ACDF, which is a anterior cervical discectomy and fusion. This is reserved for people that do have the same type of disc herniation, radiculopathy causing the arm pain, but also have an arthritic component to their imaging. So ultimately, instead of doing a total disc replacement, we opt to do a fusion surgery to eliminate the motion caused by the arthritis that would continue neck pain after the patient is healed. So now that we know a little bit about the surgical option, let's go to the OR and I'll walk you through the steps of an ACDF. The first step is we make a small incision on the front of the neck. And this is the easiest way to access the disc herniation that is causing the spinal cord or nerve root compression. We also use x-rays during surgery. One reason we use x-rays initially is to mark the correct level. And then during the procedure, we also check progress with x-rays to make sure that we are doing the proper bony resection to fit the appropriate size cage to enhance fusion. After x-ray confirmation, we do remove the entire affected disc. It's our visualization to be able to get back to where the disc herniation is that's causing the compression or stenosis of the spinal cord. Once this disc is removed, the full compression is done. We have to put something back in the disc space to hold it in the proper alignment. This is done by placing a small cage, which acts as a scaffolding to hold the disc space in the appropriate alignment. And the inside of the scaffolding, we have a window where we put bone, and this is ultimately where the fusion will happen between the adjacent vertebral bodies. Once this cage is placed in, we do one final x-ray check to make sure that the bone graft and cage is in the appropriate alignment. After this, we're done. After a one-level ACDF surgery, the patients typically stay one night in the hospital. And then for the 3-month period after surgery, which we consider the post-op period in the healing process, I restrict their activities with regards to I do not want them doing any excessive heavy lifting, more than 15 to 20 pounds, or a lot of overhead activity. Once we get to the 3-month mark and the fusion has solidly taken, at that point they can progressively do activities as tolerated without any restrictions. Thank you for listening in today. If you have any questions, concerns about ACDFs, please put them in the comment section below.